Welcome to the next bit bite-sized. I'm Hannah McQueen.
And I'm Mark Leishman.
Does your bathroom cabinet look like a chemist? Full of pills for different conditions that all look the same, with instructions in small print, probably expired. The more medications you take, the harder it is to remember what to take. But getting it wrong can have serious side effects. It could even be catastrophic.
Consultant pharmacist Julia Brooks, she's the lead pharmacist at Brightly, encourages you to be proactive, to ask for help and learn about your medication. And it can help you feel better and live longer. So let's hear more. Julia, a personal question, I guess. How important is it to take your medication correctly?
It's step one of getting it right. Absolutely. You know, medicines, pharmacists talk about the 5 R's, the right medicine at the right dose, at the right time, by the right route, and for the right indication. So the five R's of medicines management. Any of those things aren't correct, things can go haywire.
Right. So if your doctor says take it at night, you take it at night.
Absolutely.
You never fail.
Yeah.
What if you forget though? If you know.
That's a really good question. It depends on the medicine, and that's the question you should be asking your pharmacist or your doctor. So, for example, if it's a sedative designed to help you sleep and you forget it,
you'll be awake.
You definitely don't want to take it in the morning, do you? You know, and if you do sleep without it, then great. Perhaps that medicine is no longer indicated, or you should be looking at, you know, reducing the dose or the frequency you're using it. If it's a medicine that's prescribed in the morning, it might be because it's going to make you pee all day. And if you take it at night, suddenly you're not sleeping at all. So really important to take it at the right time. And it can also be because if you're on combinations of medicines, some of them fight with each other or interact. And so you have to separate them by a certain number of hours. So if you take everything in one big pile, it can inactivate certain medicines or, you know, reduce their effectiveness.
What are the things that make it harder to take medications correctly as you age?
So 3 key things. First is polypharmacy, which is being on lots of medicines. It's generally defined as 5 or more regular medicines. The reason that's a problem is the more medicines you're on, the increased complexity of the medication regime. The more complex it is, the more chances are that you'll mess something up, forget it, get muddled, take the morning ones at night, the night ones at morning, miss a dose, all of that. So that's the first one. The second thing is person-related factors. So visual, impaired vision means that you might not be able to see the labels on your bottles. Arthritis and physical problems with your hands mean you might not be able to open containers and things properly. Problems with your hearing means that you might not have actually heard the instructions correctly, and if you can't see and hear well, then you've got a double whammy. Problems with cognition. So if you are being a bit more forgetful, you're much more likely to forget that nighttime medicine. Often people remember their morning ones because it's part of their routine, and the night ones get missed. So, you know, those are probably the major ones. The last one I would say is understanding and knowing your medicines. If you know what you're taking and you know why and what it's for, you're much more empowered and therefore likely to be proactive about making sure you take it. If you're not really sure what they're for and it's sort of a wishy-washy, well, I've been told to, it's much harder to be proactive and self-motivated. You know, anyone who's ever tried to say lose weight because their doctor told them to will know that it's much more difficult than if you've decided that you want to. You know.
At Brightly, as you know, as our lead pharmacist, we really encourage our members to have a medication review, which is led by you, working with the geriatrician and some other specialists in our wider multidisciplinary team. Why is that important? Because I believe it's necessary for all members, but in your words, why is that important?
Essentially, as you age, the risk of medication problems, you know, harm from medication, side effects, increases significantly. And that is an issue as you age, and it's also an issue depending on the number of medications that you're on. So once you hit that kind of threshold of 5 or more regular medicines, you are 75% more likely to have a fall. You are significantly more likely to be hospitalised for any reason, and we even know that it increases your risk of dying from anything. We call that all-cause mortality. So medicines in older people cause harm, and that's because your body doesn't process them the same as when you're young. You're more sensitive to the side effects. Some of the medicines may no longer be appropriate or indicated, and unless you actually sit down and take the time to do a focused look at what you're taking, you won't know whether those medicines are problematic. You won't know whether you're getting side effects from them. And often that's, in my experience, obviously I'm really passionate about this because it's what I do, it's a real issue for people. They don't know what they're on, they don't know what to expect, and they don't know that they're actually getting side effects from their medicines because they've put these things down to as, I have to accept these, it's a normal part of ageing, when in fact it's not.
I guess it's all well and good me saying you should have a Brightly assessment and work with the Brightly team because I believe in it, but not everyone will want to do that or can afford to do that. So is the next best option to go to your local pharmacist if you want your medications reviewed?
Absolutely. I mean, not all community pharmacists have the time or the capacity to do a full medication review. Certainly not a deep dive medicines optimization review like we do at Brightly. They just don't have there's no funding, they don't have the capacity, they don't have the expert postgraduate training and things that
yes, they're not necessarily qualified.
Correct. However, they can provide you with that, advice on the individual medicines that you're on. They can provide you with education about what side effects to look out for, and they're already in the background screening for interactions, screening for potential problems. But for example, if your medicine's been prescribed at night, and you've been told to take it at night, and the first time they hand it out to you and they say, have you had this medicine before? And you say no, and they explain it, they're not going to have that conversation necessarily with you in 6 months' time. But if your cognition is reduced, or
You forget, yeah.
you're now on 3 or 4 different medicines when before you were only on one, and now you're getting them muddled up, unless you ask a question, they won't know to provide you with that advice and support. And the same is true with your GP. So use your pharmacist, use your GP, use your nurse in the practice as well. There's a lot of really experienced nurse prescribers and nurse practitioners who can, provide support with medicines management as well. So, Brightly, obviously for me, I think it's the gold standard because it's that really high level expert wraparound service. But there's a lot of other health professionals who want to help, but you just have to be proactive about asking for it.
Is there one piece of advice, possibly you've just given us it, but the one piece of advice you think...
Ask questions.
Yeah.
Make sure you know what your medicines are. What are they for? What are they trying to achieve? And what are the side effects you might be, needing to look out for? Or in reverse, the question I tell my patients to ask is, I'm experiencing X, dizziness, blurred vision, dry mouth, whatever. I'm experiencing this. Could it be a medication side effect? That is the way to ask your doctor. Because if you say, I've got this problem, the kind of traditional paradigm of medicine is doctor is presented with a problem, they assess the problem, they think about what could cause it, they think about how they could treat it. A pharmacist goes, oh, you're having a problem, could that be a drug side effect? Straight away that's where we're headed, and that's because it's so common, but it's just a different paradigm. So asking your doctor, I'm experiencing this side effect, this issue, could it be a side effect of any of my medicines? Will give your GP a chance to pause,
Focus,
and say, let's have a think. Actually, yes. But if you go in with, I've got a rash and I've got a this and I've got a that, it's going to get lost in the noise.
Yeah.
Exactly. Yeah. And the same is true of your pharmacist. So knowledge is power. And get informed, get interested, get motivated to get interested.
Thank you.
Thank you, Julia. And if we have left you wanting more, you can listen to the full-length podcast. It's called Can Managing Your Meds as You Age Help You Live Longer? It's right here where you found this podcast.
And if you need help with your meds and your health in general. That's what Brightly is for. We look at medications as part of the bigger picture, alongside your health, mobility, lifestyle, and risk. So things don't just slip through the cracks. You can find out more at agebrightly.co.nz. Thank you for listening. We'll see you again on the next bit.